to the media who is here at the Ministry of Health, to members of the public looking on the various platforms. Welcome to this media conference at the Ministry of Health. This press conference has been called to address issues of recent concerns. First of all, as Minister of Health and also as a father, let me say that I offer my deepest condolences to the families affected. As a father, I would not know what they are going through. So we offer our very deepest condolences to the families affected. Having said that, it is incumbent upon us at the Ministry and the Northwest Regional Health Authority to put this very serious, rare, and unfortunate incident in some sort of context so that the public could be advised as to how to digest it. We run a public healthcare system in which there has been a very unfortunate incident in one ward, one department of one RHA. I want to put that on the table so that the talk out there about a collapse of the healthcare system could be seen as just that, talk. Unfortunately, some babies have died. The causes, exact causes of each one are yet to be determined. And we are determined to find out those causes. That is why we are having these investigations. Let me reiterate, it is one department in one RHA. The rest of the RHA system, even during this very unfortunate incident, operated to deliver health care to our citizens and our children. No other RHA was affected, and the Port of Spain General Hospital continued to perform. All our health centers are open. It is unfortunate that the issue, whilst of great national importance, it is unfortunate that it has now been politicized, and politicized to a point where if we don't treat with the misinformation out there, it can threaten not only the public healthcare system, but also the private healthcare system. And I'll explain why in a while. Ladies and gentlemen, when it comes to maternity care, the public healthcare system accepts willingly and without question every complicated pregnancy from the private sector, which we treat with. For many reasons. One, the private sector does not want the liability. Two, they don't have the personnel. And three, they don't have the equipment and facilities. And we accept them willingly and openly and no questions asked. In that context, we have brought down maternal mortality rates in Trinidad and Tobago, where now it is a very rare occurrence. So when people say the healthcare system has collapsed, it is difficult to imagine that as compared to what we have actually accomplished and what we have done. The public healthcare system also, without question, accepts every single sick baby, sick neonate, premature baby, freely into our neonatal intensive care units without question. Why? Because the private sector does not have the capacity, never did. It is only recently that one private sector institution instituted 2 neonatal intensive care units, beds, 2. We accept all, with the Port of Spain Maternity Hospital, NICU, being the reference one for the country. We have 92 NICU beds across our public healthcare system. Private sector has 2. which they only developed recently. The reason why I'm saying this is that in addressing some of the unfortunate reporting, it was said that a possible source of the infection was from a private facility, Sanjivini. May I state here now categorically, we have received no babies from that institution. And that's why I say if we don't treat with this issue, it has the potential of affecting private sector operations. This private sector hospital was sadly called in this. Another private sector hospital being called is St. Clair Medical, where it was said that because the baby belonged to a certain ethnic group, that we allowed 7 people free rein in the NICU. May I tell the public that no such event happened. And it is unfortunate that facts in this modern era get no currency. So let me just say that. The public healthcare system, Northwest has a level 3 NICU, that is the most sick babies, where the country refers to the premature babies. And let me just repeat one paragraph which Dr. Fuad Khan said. I hate to call him as a reference, but he said this: you are talking about children who are smaller than the size of the palm of your hand. This is the palm of your hand. This is what we do in dropping neonatal mortality rates, and we have done well. So it is very difficult to nurse these babies, and they have to do a lot of things. That is what we do. So I want to put it out there that these babies are very, very ill. Many are even born with congenital birth defects, and that is being lost in the equation. That have, and Dr. Timothy will talk about it, very little rates of survival with congenital birth defects. North Central also has a level 3 NICU, San Fernando General Hospital a level 3 NICU, and San Luis Grande a level 2. So that's the array of NICU beds across the public healthcare system. 92 beds, with the private sector, again, only recently bringing on 2. I now need to turn to some very unfortunate statements by Dr. Tim Gopi Singh and the Honorable Kamla Prasad Bisesa, leader of the opposition, talking about the Couva Children's Hospital. Ladies and gentlemen, they forget that we have an existing Wendy Fitzwilliam Children's Hospital, which was never at full capacity. We have the Mount Hope Women's Hospital, and if there's a difficult delivery on a premature baby, it goes to the NICU at the Mount Hope Women's Hospital. But to keep on hearing that if the Couva Hospital was open and that we are closing it for spite, is paying little regard to what has been happening at Couva. You would believe, listening to Dr. Tim Gopi Singh and the Honorable Leader of the Opposition, that the Couva Hospital is mothballed, even though I have spoken in the past about the use of Couva. Let me tell you what has been going on and what is going on at Couva. On 1st November 2023, the NCRHA Heart Function Cardiac Rehabilitation Center was started there. They do first visit consults, follow-up consults, telemed consults, and walk-ins. More importantly, the protest action inspired by the UNC at Couva on Saturday disturbed the operations of the facility where 20 patients were carded to have cataract surgeries. Now, the public doesn't know that. So they endangered the lives of staff and those patients who were carded to have cataract surgeries. We did not know if they were going to keep on the protest on Sunday, so we had to postpone it. So 20 patients who were depending on us in a functioning hospital to have cataract surgeries couldn't have it because the Honorable Kamala Prasad Bisesa probably inspired her followers to go there. At Couva, total patients referred for cataract surgeries, 291. Of that, 90 have already received their cataract surgeries, and we were supposed to do 20 more. It's a functional hospital. I would have told the country years ago when we started to use Couva that we were using all the radiology equipment. From January 2023 to March 2024, there were 84 ultrasounds done at Couva, 1,137 mammograms as we assist women to find out their status as far as breast cancer is concerned. CT scans, 1,801. MRIs, 883. And X-rays, 830. This is what we have been using Couva for, in addition to operationalizing Couva for COVID, where thousands of patients would have passed through Couva during the COVID period from 2020 to now. So for the opposition to insist that Couva is closed is just an outright untruth. And it's unfortunate how we fall for that. And let me just reiterate, the Wendy Fitzwilliam Children's Hospital has always been functioning, always. In addition, the San Fernando General Hospital has a full pediatric unit, So it is not to say that children are not getting care in our hospitals. The Sangre Grande Hospital has a full pediatric unit. And in Tobago, there's a full pediatric unit. And when we open the new central block, there will be a full pediatric unit. Port of Spain General Hospital, unfortunately, never had a full pediatric unit. But when we were doing the design brief for central block, we insisted that a pediatric unit be put in there. So one of the editorials quite rightly said to the opposition that Couva is not the be-all and end-all. I'm just paraphrasing. Ladies and gentlemen, again, I want to empathize and sympathize with those families. I mean, my heart goes out to them. Only a parent will know. But from 2015 to now, although this is not a time for global statistics, it is a time to empathize with that statistic, 7. But the way the discussion is going in the national space, because I saw one letter to the editor today which says, is maternal and infant health a priority in Trinidad and Tobago? Yes, it is, has always been. And that is why one of the signal achievements of the Ministry of Health since 2015 is bringing down maternal mortality rates and neonatal mortality rates to below our SDG levels, which was supposed to be hit by 2030. We met all our SDG targets for maternal mortality, and neonatal mortality 12 years ahead of schedule. We hit them in 2018. This one isolated, rare incident is something that all of us regret. And we must say so. But we will put steps in place, and you will hear from Major Blake as to what we did. As soon as we recognized the problem, we took steps above and beyond the normal procedures, above and beyond, so that the NICU, which was closed down for 4 days, not the NICU, that one part where we stopped admitting, we will start back admitting from the 7th. Because without a functioning NICU at Port of Spain and throughout the system, the entire care of our neonates, babies that you can fit in the palm of your hands, some weighing as little as 2 pounds, could stand a good chance of survival. I saw it in one of the Northwest pullouts, because this has been there in the public domain, babies with tubes coming. That is a normal NICU practice. You must have feeding tubes. You must have IV tubes. And yes, it is a shock to us when we go in there and see it. But without those tubes, those precious babies will not survive. I need to correct another statement, and I want to read out part of Southwest Regional Health Authority's response to an article in one newspaper, where it says, healthy baby dies at San Fernando Hospital, and shares the experience of a former valued client. The second paragraph goes on to say, while the newspaper article asserts a certain level of innuendo, inviting unnecessary speculation, the authority was not proactively afforded the opportunity to respond prior to publication. Ladies and gentlemen, all I am asking for as we move forward in treating with this very, very serious issue is that we have a lot of compassion, not only for the parents, but for healthcare workers. You have 20,000 healthcare workers going out day in, day out, day and night, doing their very, very best under very trying conditions that currently prevail. We just ask for some accuracy in the reporting. I have given you 2 examples with Sanjivini, which a newspaper said possibly sent an infected baby to us. I have confirmed that that simply did not happen. So, ladies and gentlemen, that is what I could say for now. We are very concerned about this issue. We are very concerned for the parents. We have provided free private sector psychological counseling for the parents. We are doing everything possible to ease whatever pain that these parents are feeling at this point in time. It's not an easy time for them. I am absolutely sure of that. But we will do everything to support them in the most empathetic manner moving forward. I will now ask Major Blake to tell us what is going on operationally at the NICU in Port of Spain, and afterwards I will ask Dr. Marlon Timothy to make a few remarks, and then we'll take your questions. Thank you very much.
Thanks very much, Minister. Good afternoon, again, Minister of Health. We just recognize the Permanent Secretary, members of the Ministry of Health staff, members of the Northwest Regional Health Authority, of course, members of the media, and the listening and viewing audience online. I want to thank you for joining us today, and today's press conference is, of course, intended to discuss with members of the media and by extension the general public the status of the unfortunate events surrounding the passing of some neonates at the neonatal intensive care unit at the Port of Spain General Hospital. But before I officially begin, I want to echo the Minister's sentiments about the empathy that the persons at the Ministry of Health and at the Northwest Regional Health Authority feel with the parents that would have unfortunately gone through this tragedy. I also want to echo the Minister's support for the staff throughout all the RHAs, but especially the staff at the NICU at the Port of Spain General Hospital, that I must say to the media are going through an extremely tough time at this point in time. We want to assure the public that we are working closely with the relevant authorities to investigate the root cause of the outbreak and so to prevent incidents from happening in the future. Our commitment to transparency and accountability remains unwavering throughout this process. This morning, the management team of the Northwest Regional Health Authority would have met with the investigation team from the Pan American Health Organization. And yes, PAO is here. They would have come in the country last night, that investigation team, and would have swiftly moved to meet with the management of the Northwest Regional Health Authority for a couple hours this morning to look at firstly the terms of reference for that investigation and to request from the Northwest Regional Health Authority relevant documents and to schedule interviews and so on. And I want to say that we are committed to providing PAHO with all the information they need and access to all the relevant persons in terms of interviews moving forward. Additionally, we must also say that the Northwest Regional Health Authority is in receipt of pre-action protocol letters in relation to the passing of 11 babies, 7 of which belong to a cluster occurring between the 4th and 9th of April 2024 involving a bacterial outbreak. The earlier babies are not connected to the April cluster. Because of the pending litigation and because of the privacy issues, the Northwest Regional Health Authority is really constrained in speaking directly and specifically about the individual cases. It should be noted that each case is separate and again must be looked at individually. That said, for clarity, we will now give some details on what has occurred and the steps taken thus far by the NWRHA to prevent a recurrence. Yeah. Say again? Okay. Sure. With 2 neonates displaying clinical signs of sepsis, immediate action was taken to address the issue and identify the cause. The NICU was immediately closed and new admissions in keeping with the infection prevention and control protocols. All the neonates were cohorted, screened for infection, commenced on antibiotics, and those meeting relevant criteria were discharged. Visitation was restricted and there was an increase in active surveillance of all patients. The head of department of the NICU of the Port of Spain General Hospital would have alerted the hospital administrator to concerns about the NICU, and immediate sanitization was done by an external provider. Kariri was also engaged, and air quality, surface, swab, and water testing were done. The Northwest Regional Health Authority's internal domestic staff maintained stringent infection prevention and control IPC protocols moving forward. Initial laboratory analysis confirmed the presence of 3 different bacterial organisms known to be associated with neonatal infections. Further analysis are being done at this point in time. Despite our best efforts and the implementation of intensive care measures and antibiotics for all infected babies, a total of 7 preterm babies would have succumbed to infection between the 2nd to the 9th of April. Today, with a heavy heart, I do stand before you to confirm that the number, apologies. So, we await reports from Korea and PAHO to confirm the details of when the bacteria may have begun and its extent as we do our own internal investigations. Each demise that occurred outside the cluster from April 2nd to 4th must be considered. NWRH's priority has always been to continue to look at the health and well-being of all our citizens and patients, and not to lose faith, and not for the public to lose faith in public health care. We understand the concerns and questions that may arise from the tragic event, and we are fully committed to providing updates and additional information as they become available. Thank you, and again, we sympathize and empathize with the parents.
Good afternoon, everyone. Honorable Minister of Health, Permanent Secretary, CEO of the Northwest Regional Health Authority, and other health professionals. Good afternoon. I'm here to bring context into what the work of a neonatal ICU involves. The neonatal period involves the first 28 days of life. So any baby who is less than 28 days old is considered a neonate. That can then be broken down into the type of neonate, whether it be preterm or term. So both preterm and term babies can be admitted to the neonatal intensive care unit. We have term babies. We know that when we speak to mothers, they say they were delivered at full term, and we use that as more than 38 completed weeks of gestation. Less than that, we consider those babies preterm. We have different categories of preterm also, where babies who are born less than 28 weeks are considered extremely preterm. Those born between 28 and 32 weeks, moderately preterm, and so on. So to give context to that as well, we also categorize babies by weight. Babies born less than 1,000 grams, and as you can imagine, some of your phones may be at least as heavy as that. 1,000 grams or less is called an extremely low birth weight infant. Less than 1,500 grams, a very low birth weight infant. Less than 2,500 grams, a low birth weight infant. These are some of the categories of weights that we'll also use when admitting babies to the neonatal intensive care unit. The Port of Spain NICU accepts the smallest babies in Trinidad and Tobago from as low as 500 grams. Those babies sometimes can take up to 3 to 4 months of intensive care prior to discharge. I'll speak briefly on some of the complications encountered in preterm babies, and especially in preterm babies. Now, as most of you may imagine, the NICU, as you've heard, is not a baby nursery. It's actually a specialized area that produces and provides highly intensive care for these extremely small and vulnerable neonates. As a result, specialized equipment, staff, and expertise are always required. These babies are very, very immature and sometimes do require extensive months of rehabilitation in order to do the things that a normal full-term baby would be able to do. One of the major complications, unfortunately, of prematurity is infection. The World Health Organization has listed neonatal sepsis as the #1 reason for neonatal mortality across the globe. So this is not new to Trinidad and Tobago, but this is a global phenomenon as well. We do unfortunately empathize and sympathize and do extend our deepest condolences to the parents involved in this matter. And we continue to work diligently with the babies that we do have in the unit to ensure that recurrence does not occur. Another significant factor with some preterm babies is, of course, brain and lung development. Some of these babies, of course, coming out so early, do not have the requisite capacity to actually engage in life-sustaining vitals without the help of the medical professionals. These babies will be placed on ventilators, may require additional therapy for their lungs, and can actually stay on a ventilator for up to 2 months at a time, or even longer, just to have their lungs mature enough to breathe comfortably in room air, as we are all doing now. Additionally, their brains are monitored significantly for signs of bleeding, because unfortunately, preterm brains are very, very fragile, and the blood vessels are not fully formed. Thus, encouraging simple tasks may encourage a massive, what we call intracranial hemorrhage, where resultant bleeding can actually lead to disability permanently or even death. Neonates, especially preterm neonates, are very difficult to manage. Some of these babies do not even digest milk, even their mother's own milk, properly, and that can take even months sometimes for that to actually happen. It is not a simple task. It is quite an arduous, long process. The team in the NICUs across Trinidad and Tobago are extremely dedicated to having these neonates have the best care possible. We are always conferring and consulting with each other. We are always helping and assisting each other, and we are always providing that level of care, what we call the right baby to the right level of care, based on the expertise available at the different regional health authorities. So again, in closing, I want to emphasize that we are very committed to encouraging and engaging all stakeholders at this time in understanding the work of a NICU. Today we would have put out into the public domain a spread explaining just briefly, in part, what the NICU is, what the staff at the NICU does, and we hope to continue to educate the public on the work that the NICU does, and look forward to the public's participation in further educational series on the neonate and prematurity. Thank you very much.
Right, so ladies and gentlemen, thank you. So now we'll take your questions as we open the floor. Yes, just say your name and where you're from, please. Thank you.
Good afternoon, Minister. Mr. Doughty, Trinidad and Tobago University. I noted that Dr. Timothy would have said that neonatal sepsis accounted for neonatal mortality across the globe. And in your presentation this evening, you would have mentioned that this particular incident is rare. So can you just tell us how rare is this bacterial infection in?
What I was talking about was a cluster. In this case was red. So, but Dr. Timothy could fill you in on the technical details.
Thank you. So, for clarity, neonatal outbreaks can happen and have happened all across the globe. So this is a global phenomenon. Even in first world settings where the NICUs are purpose designed and built, you can still have neonatal clusters of infection or outbreak occurring, and I've seen this firsthand in first world settings as well.
How frequently does this occur?
So again, when something like an outbreak occurs, because there is such extensive investigation by the hospital and the parties where that outbreak would have occurred, the lessons learned from that are implemented, and they are, you try to make sure that that recurrence does not occur. So to give you an estimate as to how many NICU outbreaks there are in the world, I can't give you an exact figure right now, but if you do a search of the medical literature, it's quite replete. It's full of examples of NICUs having infection outbreaks, again, across the world.
Testing for the Minister, good afternoon. Jesse Ramday from CNC3 News. Having met with the officials from PAHO this morning, they came in last night as indicated. Can you provide further details about the conversation? Was a scope of work provided? Any timelines given? Any further details as it relates to that meeting and when perhaps the investigation can commence, can end, etc.?
So first of all, the Minister of Health did not meet with PAHO. The technical people met with PAHO. I, as Minister, am not getting involved in the investigation. So no one can say that the Minister inserted himself into the investigation. PAHO is doing an independent investigation, having been invited by the Ministry of Health through the Office of the Chief Medical Officer, who is the focal point for PAHO. So I have no role in either meeting with them at the airport, talking with them. I will not be meeting with them. They will be meeting with people as they see fit. As to your question about how long it will take as long as it ought to take to have a complete, thorough, transparent, independent investigation. I, as Minister, will not be putting a time frame on it. I think the parents deserve that.
Hi, good afternoon. Alicia Boucher from TV6 News. Let me just follow up on Jesse's question.
Sure.
I know that the NWRHA would have met with the PAHO team this morning. Can you tell us who is leading that team in terms of the investigation? How many members are in the team? And if you are, since you all did speak about terms of reference and so on, give us an idea into what those terms of reference are.
Thanks for your question. Mike? Yes, so thanks for your question, Alicia. I want to reiterate that PAHO's investigation is independent, and while yes, we'd have had an initial meeting with them, we wouldn't want to share any details about that meeting to prejudice the conduct of the investigation. Yes?
What I can say is a three-person team. 3 people are physically here, but they are also communicating with experts around the world virtually to bring their expertise. So 3 physically here that I was advised came in yesterday, and they are communicating with experts around the world.
Can we find out the names of those 3 persons that are here?
I don't have the names, and I don't want the names. I am taking a political hands-off approach to this. Let PAHO do their work. I'm sure when the report comes in, it will have all that.
Minister, Shilana Ansubad from the Trinidad Express.
You're new?
Yes,
relatively. Okay, good. Welcome.
Yes, thank you. A reader would like to know, so they want to know, how does the NICU death rates in Trinidad and Tobago compare to developed countries? That's number 1. And does Trinidad and Tobago have a higher rate of mothers giving birth prematurely when compared to the world?
Afternoon, thanks for the question. So just for comparison, if I may, Canada, let's say for example, has a neonatal mortality rate of 3 per 1,000. The USA has a mortality rate of about 4 per 1,000. These are live births. Within the Caribbean, Trinidad and Tobago, as Minister would have alluded to earlier, would have achieved its Sustainable Developmental Goal, which was set at a benchmark of 9 per 1,000 for the Caribbean and Latin American region. Trinidad and Tobago would have been able to achieve a rate as low as 7 per 1,000 live births since 2018. With that said, it's a fluctuating rate based on sometimes events like this, but generally we've been able to maintain that rate of about 7 per 1,000 live births. For context again, as we would put out today, Barbados has a rate of about 8 per 1,000, Jamaica about 10 per 1,000, Guyana about 17 per 1,000. So just to give context as to how Trinidad and Tobago stacks up both internationally and regionally.
Okay, so my question is for you, Dr. Timothy.
Sorry, I think there was a second part to the question about about how many mothers are delivering prematurely. is an increased uptake of babies delivering prematurely because of different reasons, right? Maternal health reasons, actual reasons within the fetus that's in the mother's womb. So there are some increased rates of mothers delivering prematurely. I would not be able to give you a figure right now, but we do have that data that we can make available to you.
And the uptake or the increase in that rate, what period of time would you say that accounts for? Is it like this year, 2024, 2023 to 4? What period are you seeing the increase?
Yeah. So again, very interesting question. So while we've actually noticed a declining birth rate, we've actually noticed an increasing prematurity rate. So that period would have extended from as early as 2017 till now.
Okay, Dr. Timothy, you had another question? So Dr. Timothy, based on the stats that we have, right, we would have experienced the first, in terms of the cluster of 7, we would have noticed the first death on April 2nd. I'm seeing 1 on April 4th, April 5th, 3 on April 6th, 1 on April 9th. My question to you is, given, the infant mortality rate and what you are accustomed seeing in the NICU, surely one death may not spark concern, but over a period of days, if you start to see those deaths, would a red flag have been raised or should have been raised, taken so long to have been raised?
Looking at Major Blake's statement, he would have alluded to the steps taken only after 2 babies were noted to be unwell. So no, there was no delay in treating with that situation. What would have happened is because we could not discharge some of those babies, they had to be sequestered within the unit and managed accordingly. It is always presumed that they might be infected, and so you have to do tests and so to determine, right? But since this, of course, is a legal matter, I do not want to divulge too much information further.
Minister, this question is for you and for probably anybody else who wants to take it. In speaking with some of the parents who are affected, I did get a good bit of feedback from them. Some of them said, yes, they were communicated with. Yes. NICU was calling them. They were in touch with members in the NICU and so on. But from the legal notes, we are seeing another side of things. I know it's it's a legal matter. But I wanted to ask, in terms of customer service at our hospitals, at our public healthcare institutions, are you concerned? Do you think that we need to do something more in terms of training people in customer service in particular?
Yeah. So thanks for raising the issue, and thanks for saying that the parents said that they were always in contact. We had counselors. The doctors and nurses were very empathetic with them, held their hands through the process. And we did that. Your question, can we do better as far as customer service in some areas are concerned? Of course. Training is an ongoing thing that we do, and we do that all the time. But let me say, the vast majority of our professionals execute and discharge their responsibilities professionally and empathetically. There may be, in any large system, whether it's banking, fast foods, anything, hospitals, there may be 1 or 2 persons who don't buy into the culture of customer service. And coincidentally, we had a big discussion about this over the past year, about constantly retraining, especially when it comes to being empathetic. So yes, those few persons, and the old story about one bad apple spoils the whole barrel, that happens. And I'm not going to stand up here and say everything is perfect. In a large system like this, you will have, from time to time, incidences of bad customer service. But in this particular case, every parent was dealt with the extreme empathy and sympathy.
Allow me to just ask another question. I believe it's Gladys Gaffer had done a report into the healthcare system under the Manic administration. And one of the tenets of that report dealt with what they called, I believe it's no-fault compensation. That was a recommendation in that report because she would have noted that, you know, after going through some of what would be an ordeal already, then you have to come and deal with the legal side of things, and that could take a strain, put a further strain on persons who have gone through that. And she suggested that we have no-fault compensation. Is that being considered? Why wasn't that ever considered, and so on?
We're talking about this specific case. That has always been an approach. But if the patients decide to seek their own legal advice, we can't stop them, right? But that has always been an approach. But it's up to the patient and their family and or estate.
Final question from
Sure.
me, and either Mr. Blake or yourself can take it. We did have a report on the boiler at the Port of Spain General Hospital being down, and in terms of that impacting the autoclaves. There are 4 autoclaves that are not in use because of that boiler. I understand that there are 2 in maternity department. One of the allegations would have been that one is malfunctioning and the other is a small autoclave. Can you tell us at this point, at this time, what is being done about that boiler, especially that we were made aware that the NWRHA would perform sterilizing for other institutions as well, a number of them, as well as private institutions. So can you tell us what is being done about that boiler and what is the situation?
Surely, sir. Thanks for that question. And I think you would have actually reached out to me to have a conversation on that boiler. So I'm very much willing to provide an update. So you are correct. There is a boiler at the Port of Spain General Hospital. Last year, around May, June month, we would have done a recertification on the existing boiler there. It cost us, I don't want to disclose the figure, but it did cost us. After that boiler was recertified, it lasted for a very short time and then became deficient again. We brought back in the supplier that we had the service level agreement with. He said to us that the boiler lining was damaged and aged and it needed to be repaired, even though he certified it maybe about a week before and so on. We tried to get a second opinion on it, which we did. The cost was prohibitive to repair that old boiler. We had an additional, a fairly new boiler at the St. Anne's Hospital that we decided to repurpose and bring down to Port of Spain General Hospital to utilize. However, the connections on that boiler didn't fit up with the existing connections that we had at the CSSD, Central Sterilization Department, and so on. We then decided to go out for tender, for public tender, for a new boiler for the CSSD department. Around that same time, we had the new legislation come in, and of course, wanting to do things the transparent way, we went out for public tender for a boiler. I'm proud to say that that tender is, money has been allocated for that tender. It was actually published in the newspapers widely and on our social media sites. We have a selected proponent for that, and it's in the standstill period right now, just before being awarded. In addition to that, realizing that there was a capacity issue with the boiler, the board would have approved purchase of a new autoclave for the maternity department at a cost of about $1.2 million. That autoclave was installed in, I believe, March of this year and is actually in the maternity department now. So yes, we do have 2 autoclaves in the maternity department. I myself was at the maternity department yesterday looking at the autoclave, speaking with the staff and so on. So those 2 autoclaves are functional at the maternity department, and we have staff rotating in there, and there is sufficient, how should I say, capacity to sterilize the equipment that we have at Port of Spain General Hospital now.
Are the 2...
You just said about the last one, huh? It's all right.
This is a follow-up one.
Go ahead.
Are those 2 autoclaves, given your workload in terms of sterilizing for a number of institutions, are those 2 autoclaves adequate?
So I would say yes at this point in time. There is also an autoclave at the St. James Medical Complex that is utilized for sterilization across the RHA also.
So given the increase in the premature births from 2017 to now, is there anything that the Ministry of Health will be embarking on to maybe reduce the number of premature births that they are seeing? Is there anything that can be done?
I think that's a question really posed to the Directorate of Women's Health, because they would have engaged several initiatives over the last, since 2017 actually, to be able to speak to and address with that issue. So I think, unfortunately, the Director is not here, but that's a question best posed to him.
Yeah. So let me just tell you what has happened globally. As you may know, and this is a general statement, two things are happening in Trinidad and Tobago. One, our birth rate is declining. When I first became Minister of Health, our fertility rate was 2.1. For a country to replace its population, a woman needs to have 2.1. I know it sounds stupid, 2.1 on average, 2.1 babies over their fertile period just to replace their population. When I came in as Minister of Health, we were at about 2. With each passing year, our fertility rates are declining. We are now down to about 1.7. So we are producing less and less babies, but I can't say for sure, as your question is trying to imply, that the rates of prematurity are going up. I will have to check with Dr. Adesh Sirji Singh on that. But bear in mind that women are having children much later in life. We have a very, no pun intended, big obesity problem. We have a diabetes problem in pregnancy. And those are a lot of factors that play upon maternal health.
Minister, just dialing back to the incident that took place at the hospital. In your remarks, you asked for us to have compassion for the staff.
Yes.
and for healthcare staff. What's the status of what's the mood like among the NICU workers at the hospital at the moment?
Well, the mood is one of sadness. I think that's the biggest one. They are very, very sad because as Alicia said, they held the hands of those parents throughout the process. So they are sad. There were many tears shed. There were many, many, many tears shed. And when I see, not your reporting, when I see what people are reporting to you, which you publish, it gives the impression that our healthcare workers are callous. And I don't want to debunk that. I know you are just doing your job and saying what somebody tells you. But our healthcare workers are traumatized by this. And we even have, I think they even have counseling for staff. Because we have to see them through this also.
And that kind of leads me into this next question. Is there any consideration to perhaps rotate the staff at the moment, given the fact that they may have been rattled by the incident and may not be in a state mentally to?
And I will ask Dr. Timothy to add. So again, just to reiterate what Minister has said, the staff is really traumatized at this point in time, but NICU staff are highly specialized staff. So it's not a matter of just rotating somebody in and out and so on. We've provided counseling for the staff through our employee assistance program, our EAP program. I myself, Dr. Timothy, the Director of Health that is here today, the Medical Director, we all have gone in, and as I would have said, I was in NICU yesterday, I was there the day before, because as a team, as a management team, we realize we constantly need to check on the staff, keep motivating them, keep them centered on the mission, because you know what, we still have babies to see about at NICU. Dr. Timothy?
Yeah, I would like to echo that. So the mood is one of true sadness, and it's very somber. the feeling that the staff have is that despite the extremely good work that they do, that no matter if a patient has an unfortunate outcome, let's say because of a congenital anomaly or something like a cardiac defect that is not sustainable with life, they feel like they're going to be blamed for doing something that they have no control over. The staff are very, very hardworking. They are very diligent, and they're very compassionate. Sometimes the staff would even name the babies with the parents. They are very involved. So this matter has actually rattled them significantly. They're very sad. I've been speaking with them, getting counseling through the Employee Assistance Program, etc., and also trying as head of department to motivate them to continue to do the work that we have to do, because we do have other patients that we are caring for, and it is an arduous task to do that job with so much negativity surrounding you. So we do appreciate what has happened, and again, we do empathize and sympathize, but we also do still have a significant burden of care to provide to the other patients as well.
Let me just ask this directly to you, Mr. Timothy. Is the staffing complement at the NICU satisfactory? Is it adequate at this time?
At this time, yes.
Okay.
Okay, so I'm just putting this this question forward from. Sorry.
A last question from you. Anybody else with last questions? All right, good. Sure.
So can I ask a last question
Sure,
on behalf of everybody else?
Sure,
okay. All right, thank you. I'm just putting this question forward from Mr. Edie Stewart.
Mm-hmm.
So he wants to know whether that you as a minister would be pushing to pass the Health Sector Accreditation Act and implement the Health Sector Accreditation Manual.
We'll have to have legal advice on that before I answer.
And I'm not sure who wants to take this one, but the second question is, do we have enough specialist NICU nurses?
So what we did during COVID, so let's go back to COVID. What we did during COVID was train a lot of nurses in intensive care unit processes. If there is need to do that for NICU, we will do that. But as Dr. Timothy just said, the staffing is adequate as we stand.
Just two more quick questions. First one is to Dr. Timothy, and the second one, Minister, is to you. So, Dr. Timothy, in terms of as a professional neonatologist, a consultant, I believe you are, right? Give us an idea of how often, I guess, bacterial outbreaks. I know sepsis is a commonplace thing with neonates and so on, right? But give us an idea of how often NICUs in particular, within that particular type of environment, they experience these types of bacterial outbreaks, if you want to call it that.
I mean, that'll be a very difficult question to answer. I mean, throughout the history of Trinidad and Tobago, if you look into the archives, there have been outbreaks before that have been quite lethal as well. And, the range of time would range from 10 years apart to 15 years apart, etc. So, within the life cycle of some of these neonatal units, they may experience at least one or two major outbreaks within their life cycle. So again, it's quite rare. But there are situations where that would recur.
And final question for you, Minister. I know that you said you are taking a hands-off approach in terms of the PAHO investigation, yes. But I want to ask, would the PAHO report or even the recommendations that are made in that report be made public?
Yeah. So the report has to be read. It's an entirety. It has to be vetted by the legal officers. I cannot give you a commitment now. It will be made public, and I'll give you an analogy. When the report for the life sport program under Anil Roberts and the Honorable Kamla Prasad Bisesa came out, it pointed to significant criminal charges to be laid. And you know why no criminal charges were laid? because Kamla Prasad Bisesa made the report public in the parliament too soon. So nobody could have been held accountable. I will give a commitment to have the legal luminaries advise me on that. Because if the report shows culpability on anyone's part, if I make it public too soon, just like Anna Roberts, who got away deliberately, then you will be calling fire and brimstone on me. So for the interest of transparency, for the interest of the system to learn from this, I will only be seeking legal advice on how we treat with the report, especially as the cases are going before the courts. And I think that's a reasonable position to adopt.
Mr. Blake, just my last question directed to you. So, based on my interaction with the parents and reading the legal documents, etc., it would appear that one of the common thread here would have been the fact that these neonates needed a blood transfusion. I know that you indicated that among the steps taken, the NICU was closed, the neonates screened, visitation limited, sanitization done, etc. Any particular, perhaps, work went into the actual process that was used, which would have been these blood transfusions? Any particular microscopic look taken at that?
So the CEO is not a blood transfusionist. He is not a microbiologist. Dr. Timothy is here, but as you rightly said, this is before the courts. And Major Blake was clear to point out from the beginning, there are certain things we cannot get into. Let all this evidence be heard before the courts.
So I know that pre-action protocol letters have been sent, but the matter is not before the courts as yet, as far as I am aware.
It is going before the courts.
So you're prepared to go to court, is what you're saying?
I am saying, if it goes to court, let the evidence be led there. Let the lawyers work it out. There must be nothing that anyone says in the public domain that has the potential to unjustly influence anything. And I think it's a long-standing protocol that you don't comment on these matters where lawyers are involved.
Okay, because I was going to tell you that I noticed that the lawyers did call for some kind of proposal to be made in terms of
let
compensation.
the lawyers sort it out. I am not going to presuppose what the lawyers are trying to do. Any other questions? I just want to close on one note, because I just got the information maybe about 20 minutes ago. I noticed that it is being said by the opposition that if the Couva Hospital was opened and the NICU was operating, this may not have happened. So two things. As I indicated, our birth rates have been declining. We now deliver about 13,000 babies a year. That has gone down from 19, 20. I don't remember the old days when a common entrance class had 33,000 children sitting at one time. That's 33,000 children of roughly the same age. We are now down to 13,000. That has to be taken in context as to the adequacy of our NICU capacity of 95 beds. I have a brief from UDCOT, which says, as far as the Couva Hospital is concerned, there was no NICU. It was a children's hospital. It was a 4-bed special care baby unit for less urgent cases. So I just want to put that out there again, because it is being put out there, and the editorial was correct. As far as the opposition leader is concerned, Couva is the be-all and end-all of the health sector. But there was no NICU according to this brief I just got from UDCOT. There was a special SCBU, which is a special care baby unit. It is for what they call less urgent cases. So I just want to put that out there as another piece of incorrect information that needs to be corrected. Finally, I want to close with a very good press release sent out by the Trinidad and Tobago Medical Association. It's an association that, in my view, is very responsible. They don't speak out of turn. They don't speak in an inflammatory way. And they said in a release, which I hope you get, the care of neonates, especially those that are premature, is a complex task with many factors to consider, which include the risk of feeding problems, increase in infections, and respiratory distress, that is breathing problems, among others. Our pediatric and nursing colleagues have shouldered this Herculean task for years with diligence, skill, and empathy, understanding the delicate balance of the multiple complications associated with early deliveries. I hope you get this release, and I hope you highlight paragraph 2, which in my view is the most responsible statement put out on this very, very unfortunate incident. Ladies and gentlemen, thank you very much for coming out today at the Ministry of Health and for allowing us to put out the facts into the public domain. I look forward to your continued cooperation in getting facts out. May I thank you very much and have a very good evening.
This is TTT. Live for local.